So this is everything we've covered up to this point. Recognize eponyms when you see them. What's an eponym? Most famous patients, like people they admire, professors, after people, yeah. Break medical terms down into their basic word elements. That's what we're about to talk about now. I think I mentioned that to you guys at the beginning of the when we started chapter 1. How would you break this down into their word elements? Remember, there's a lexicon in the back of your textbook. If you go to, so we're analyzing what? Medical terms. 400 word elements commonly footnoted in this book. The lexicon, which is at the back of the book. So you will have hypo, calcemia. Okay, that's how you would break the medical terms down into their basic word elements. So if you break it down, what would that mean? How would you define it if you saw it on your test? Look in the back of your book at the lexicon. Tell me what hypo means, calcemia. What? Yeah, hypo means what? Below or what? Less than or what? Deficient. Okay. Calc, what does that mean? Calcium, right? The last part. It's a blood condition. So how would you come up with the definition? You don't have to raise your hand. How would you define that if you saw it on your test? Come on, talk, man. So you're going to see it on your test. A deficiency of calcium where in your blood, right? Or low calcium where in the blood, okay? Osteocytes. You can have what? Combining vowels. Remember I told you guys, this is, if you know how to break these words down by using that lexicon, you won't have to be looking at a dictionary, or you won't have to be Googling the definition because you'll know what it means. When you have these combining vowels, of course, it's going to help you as well. And another thing is, a lot of these words are of Greek and Latin origin, which means some of them are going to be difficult to pronounce. A student was saying the other day how she thinks the terms are difficult, hard to pronounce. And I told her, I think you can go into Connect, and there's an area or a section in Connect that will actually pronounce these words for you. So that's why Connect is so important. So, combining vowels, this is on page 20 of your textbooks that are often inserted to join groups to make the word easier to what? Pronounce. So it mentions cardiomyopathy, cardio, heart. Myo means what? Muscle. Okay. Each O is a combining vowel, although O is the most common combining vowel. All vowels in the alphabet are used in this way, such as what? Ligament. So here, osteocytes. What does osteo mean? You know what cytes, C-Y-T-E-S, mean, right? Please look in your lexicon, guys. Tell me what that word means. Break it down for me. Osteo means bone, right? Cytes. Okay, look under osteo. Some of y'all are looking at me like I have a moose on top of my head because we don't have a book. Osteo, go to the back of your lexicon and find osteo and give me some examples that they have in parentheses. If you don't have a book, look on with someone. I think they give examples, don't they? We got osteoporosis as an example under osteo. That's why you have a Connect card. Oste. Osseous, which means bone tissue, which we're going to study in here. Osseous. Okay, osseous means bone anyway. So osteocytes, those are what, bone cells that we're going to talk about in here. Chondrocytes, we're going to talk about in here. Ovulation. Microscope, microscopy. The prefix, of course, as you can see, are the same, but of course it's going to change what? The meaning of the word. You can have microscopist up here. The suffix as well, which is normally added at the end of the word, of course, will change the meaning or help you to understand the meaning as well. Microscope, microscopist, there's a prefix and what? A suffix. Okay, and microscopic. Okay, so you know biology is what? The study of gastro. So they're breaking it down for you guys with the definition of gastroenterology. All it is just the study of what? Your stomach and your what? Your small intestines or your digestive system. Okay? So if you have abdominal issues or problems with your with digestion, you will see what? A gastroenterologist, right? Which is a discipline in what? Anatomy. A prefix, blah, 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 may be present to modify the core meaning of the word. For example, gastric, if you have what? Epi, which is your pre-gastric, is your what? Your suffix. So epigastric would mean what from your textbook? Yeah, above what? The stomach. Okay, let me put one up here. I think this one was on your lab. Okay, I need you to break this one down for me. Because you got a prefix here. Chondros. Yeah, suffix. Hypochondriac. What does that mean? Because this one is one of those, it's on your lab, those 9 abdominal regions. Remember? So what does that mean, hypochondriac? Below. Chondros. Chondros. Brain. Cartilage. What's it, cartilage? Okay. Let me go back here and look. Chondros. Brain, cartilage, gristle, ribs. Yeah. Below your ribs. So cartilage, because we're going to talk about hypochondriac, hypochondros in here again. Chondros over here is going to be the ribs. So I think there was a question on your lab pertaining to that, which means hypochondriac. Chondriac means ribs, guys, below the ribs. Ribs have cartilage right here for the ribs, so it's below what? The ribs. Okay? Let's look at that last one. Discuss why precise spelling is important in anatomy and physiology. Exactly. Some of you spell, be careful with your spelling in your labs. Be careful with your spelling on your quizzes or anything in here because I will mark it wrong. Okay? If you see make sure you go through your labs to identify little notes I put on there because that spelling is something serious in anatomy. Okay? Main confusion during the Renaissance, Blessing. Yeah, I was just asking her about eponyms. Throughout the world, they were giving different structures in the body different names. They were naming them actually after people, people they admired, people they looked up to, their predecessors or professors, things of that sort. So they were naming them after people. So the NA, which is your nominal anatomical, also came into play in 1895. It rejected all the eponyms. I don't think your book mentions the TA, but the TA has actually replaced the NA because it says, okay, we're going to have one common name for all the structures across the board. Okay, so if you're in England, you cannot be calling the heart something else. If you're in the United States, you cannot be calling the heart something else. So we're going to come up with one unique name to be used by whom? By everyone. Okay? So that was a major shift that occurred with in anatomy. So I just want terminology based on word elements. This is that lexicon I was referencing you guys to just a few minutes ago. Combining vowels, prefix to suffix, things of that sort. I don't think now with these adjectivals, plurals, possessive forms, you know, you guys need to take medical term because you'll get off into all of that in medical terminology. Let me just mention these adjectival forms of the same word. Okay, I know on your test, okay, in your lab and also in your textbook, they have body regions. In chapter 1, that body of that male and female, which is on page, what page is that on? Help me out, guys. Or is that an Atlas A? It's an page 32, exactly. I think, well, this picture, one of them was in your textbook. If you look at the, this is called superficial anatomy right here, landmarks, okay? Landmarks of the body, they're important when physicians are doing an examination, a physical examination on you, but you've got to understand those anatomical terms instead of the lay terms. I think Mr. Hill came to my office on yesterday about lay terms, and he says, well, what does that mean? I said, lay term is a term that we're familiar with, you know, like the leg, but on your exam, I may put what is the anatomical term for leg, and what would you put? You would put what's plural, right? Okay, you wouldn't just put one of your choices. That's something you would have to know. And like with brachium denotes what? Arm. Okay, you can have antebrachium. Okay, antebrachium, of course. This is the brachium. This is what? Your antebrachium. If you look in your textbook, they have the brachial region, which is your what? Your arm. And they have the antebrachial region, which is your what? Your forearm. Okay. Brachii, of course, means of the arm. We're going to talk about muscles. You're going to see these terms a lot as we get into the muscles and the bones. Digiti means finger or a toe. Digits, which is what? Plural, which means more than one. You're going to have what? Fingers or toes. Like here. Flexor, digiti, mimic. It's a small muscle, or the smallest muscle that flexes. Okay, because if you understand what flexor means, kind of like this information over here with your lexicon, digiti is going to be one finger or toe of a single finger or toe. Here, small s, okay? Small s or small, okay? It's a small muscle that flexes the middle finger, okay? That's what minimi means. It means your little finger. You can have a flexor digitorum. Flexor digitorum. This is a muscle. So you're going to see these words right here when we get into the muscles. Flexor digitorum. Okay? A muscle that flexes your fingers or your toes. to allow you to do what? This right here, okay? Just to name a few, but there are others. I just wanted to put two examples up here so you guys, when you get to it, you kind of be familiar with it. Yeah. We have an extensor digitorum, flexor, extensor digiti minimi. It's a muscle that's going to allow you to extend your little finger. Flexor digiti minimi is a muscle in your little finger that allows you to flex it. All right. So going back to chapter 1. So it looks like everybody in here has done let's look at that. Plural, adjectival, and possessive forms on page 21. Okay. Leslie, well, someone, Jasmine not here, is she? Okay. So, someone read that second paragraph where it says, in some cases, what appears to be the beginner on page 21 under plural, adjectival, and possessive forms.
In some cases, what appears to be the beginner to be two completely different words may be only the noun and adjectival forms of the same word. For example, brachium denotes the arm, and brachii, as in the muscle named biceps brachii, means of the arm. Carpus denotes the wrist, and carpi, a word used in several muscle names, means of the wrist. Adjectives can also take different forms with the singular and plural, and for different degrees of comparison. The digits are the fingers and toes. The word digiti in a muscle name means of the singular finger or toe, whereas digitorum is the plural meaning of multiple fingers or toes. Thus, the extensor digiti minimi muscle extends only the little finger, whereas the extensor digitorum muscle extends all fingers except the thumb.
Exactly. Because the thumb has its own little muscle, okay? The thumb has what you call, it's called the extensor pollicis. Pollicis means thumb, Pollicis. You're going to see it when we talk about the muscles. Extensor pollicis longus, okay? It's a long muscle that extensor pollicis brevis. Long means long, brevis means that it's short. But it's going to allow, regardless, you to extend your what? Your thumb. You have a flexor pollicis longus too. That's going to what? Allow you to flex your thumb. You have an extensor pollicis longus that will allow you to extend your what? Your thumb. So I don't know. They may have it in your lexicon at the back of your textbook. Pollicis, they probably don't. No, they don't. But it's one of the muscles that we're going to talk about when we get off into the muscles. Brachii, Miss Blessing just read brachii as in the muscle name biceps what? Brachii. Okay. Brachii, of course, is going to be where? On the arm. Brachium means what? Arm. Okay? Brachii of the arm. So it's one of the muscles that's in your arm, the biceps brachii. You can't be in the forearm now. So you got to be able to differentiate between the forearm, okay, the antebrachium, and what? The brachium or the brachii. Biceps brachii, right here. You got it? Does that make sense for now? There are 3 examples of positive, comparative, and superlative degrees of comparison. You have large, larger, largest. Okay. The Latin name that you're going to see when we get to the muscle will be magnus, which means large, major, larger of the 2, maximus, largest of 3 being compared. Your gluteus maximus. Okay? That's the largest butt muscle. You have a gluteus minimus, which is your smallest butt muscle. Okay? What the gluteus maximus again? The gluteal region, gluteus largest, right? Okay. We also have a gluteus minimus. So the smallest, they're actually three. This one right here is the largest. Okay. Pectoralis major. Pectoralis major. What do you think this muscle is? It's a large muscle that's found where? In the chest region, right? Or the pectoral region. Major means what? Larger. You have a pectoralis minor. There are two of them actually. A pectoralis major and a pectoralis where? Minor. Okay? So, magnus means large, blah, blah, blah. Foramen magnum, adjectives often follow the name in a what? The noun in a name, okay? Adjectives often follow the noun. Foramen. Foramen, guys, is the whole. This is the foramen magnum right here of the skull. The spinal cord runs through the foramen magnum, which is this hole right here. Okay? And it connects to your brainstem. So you will see that again. Okay? So yeah, the second paragraph, just went over, just want to bring that to your attention. Pectoralis major, gluteus maximus, page 22. Those examples are at the top of page 22. Then they talk about names and noun variations, which, like I said, if you can understand what certain terms mean, then you'll be able to identify it when you see it on a test, like rectus abdominis. Rectus means straight. That's your six-pack. It's right here in your abdominal region, okay? Not your stomach. This is your abdomen here, also referred to as your belly region. Okay, I come over to the 22 gland. That's your stomach right there. Okay, this is not your stomach. J-shaped pouch that you see, this organ, is called your stomach. Okay? All right. So, rectus, straight abdominis, erector spinae, muscles we're going to talk about, which run parallel to your spine and keeps your body erect. Erector means straight. Erector spinae muscles. All right? It keeps the body erect. So just wanted to bring some of those to your attention. Let's see. There may be one or two of these. We're going to talk about lucidum. When we get to the skin, that next paragraph, stratum lucidum, stratum, which is the layers of the skin, the epidermis, foramen magnum, for a large magnum, a hole, which is foramen, and where the skull that I just showed you guys. So these terms, as we go through anatomy, you're going to see them all again. So when you take your skull exam, okay, this is one of the parts that you have to identify. The foramen what? Magnum. Okay? So, last paragraph, page 22, that last sentence. These few examples, only a few. You don't see a ton of these words in anatomy. These few examples, however, may alert you to some patterns to watch for in the terminology you study, and ideally will make your encounters with anatomical terminology less what? Confusing. Okay? Pronunciation. Like I said, students say, how do you pronounce that word? I can't pronounce it. You go right here, it'll pronounce it for you. This is in your PowerPoint. Simple pronunciation guides for many terms are given when terms are first what? Introduced. So a lot of, like I said, because these terms are Greek and Latin, they can be a little bit difficult to pronounce. It can be difficult to spell too, guys. But, you know, one thing I will say, you definitely got to be on par with your spelling. You're going to have to work on that spelling in here, okay? So visit this website for your pronunciation and precision. Spell correctly. Spell correctly when you do your labs. If you rush through your labs and your words are spelled incorrectly, they will be marked wrong. Okay? If I give a quiz, you know, because sometimes your quizzes aren't, I don't know, but you did that Learn Smart. If I bring a quiz in here that's like an open-ended quiz, then you're going to have to be able to spell your words correctly. Healthcare professions demand the same type of work decisions. So, because people's lives, you really have to be very, I guess it's the word I'm going to use is perfection, to strive for perfection, and really pay attention to details, because I do. I pay attention to details when you do your lab, and you, I forgot to tell you all, you do this right here. So if you see the word sloppy or messy, that's a little hint to you. Because I pay attention to everything that you write. I don't just put a grade on those labs. I dissect them. I really go through them and I look at them. Okay? So that right there, I pay attention to things like that, you know. So I kind of let you off the hook this time, because I'm like, I don't think I mentioned it to them, but I normally take off for something like that. Okay? So you may want to use a pencil when you're doing your labs. You may want to buy a pen with an eraser on it, or you may want to buy some whiteout. Okay? Because I want it as neat as possible. All right? Kind of throws me off when I start seeing. It's a distraction for me when I'm grading, because I start focusing on that rather than what, you know, the answer. Okay? So you got to picture yourself in a hospital bed. Let's look at some of these words, because one letter can change the entire meaning of a word. And if you look at some of those words in your textbook, you can easily get them confused, like trapezius and trapezium. Like those two examples they have in your book, what is a trapezius? The I-U-S. No, look at the book.
Shoulder.
That's a shoulder. Yeah, this muscle right here. The trapezius. Yeah. So what is the I-U-M? Yeah. It's a carpal bone, right? So the first part, T-R-A-P-E, identical, right? First part of those words. So I pulled that example out. I gave a muscle exam about a little bit over a year and a half ago, and you had to identify this muscle. It's shaped like a trapezoid. It's a big muscle that starts here and goes all the way up to your ossificalis. And the student asked me, he said, why did you mark that wrong? I said, because you put trapezium. That's a muscle. I said, she said, isn't there a trapezium? I said, yeah, but it's a little bone in your wrist. Okay? So, can you imagine you misspelling a word or something in a chart? You know, the doctor goes in, supposed to be working on the trapezius, that patient's muscle in the upper back, and all of a sudden they remove the trapezium, which is a carpal bone. Somebody's going to be in trouble. Going to be in a pickle. Right? So that's why, guys, I take off for spelling. Students don't understand why. They'll probably, well, I understand why. So I'm happy this is in the book. Like ossificalis, occipital, you can easily get those words confused. Zygomatic, because one is a muscle, one is what? A bone, okay? Zygomaticus, that's your cheek. Zygomatic is your cheekbone, this bone right here. But there's a muscle that covers it called the zygomaticus. Same thing with occipital. This is the occipital bone. There's a muscle that covers it called the ossificalis. Okay? Just connect. Ileum, I-L-E-U-M, look at that. I-L-I-U-M. One is a part of the small intestines. The other one is a part of your hip bone. See that? Okay. The health professions demand the utmost attention to detail and precision. People's lives may one day be in your hands. The habit of carefulness. must extend to your use of language as well. Many patients have died because of written and oral miscommunication in the hospital. Spell your words right in here. Don't want y'all to kill anybody one day. Okay? So this is it. Good. I'm tired of this. Medical imaging. These are just some different ways that they actually can view the body. I don't normally talk about those. I go right into Atlas A, which is, and I have just gone out of Blackboard. Atlas A. Atlas A. So what's the anatomical position? I'm going to stand up and do the anatomical position. Anybody? Okay. You can describe the anatomical position to me. She said, okay, I need to get my computer fixed. Too many pop-ups going on. So the palms are facing what? Forward. Was that on y'all's lab? I meant to bring one of those labs up here to, was anatomical position on your lab? Atlas A. Okay, guys, we get into this anatomy now. You really got to know this stuff right here. Major things of anatomy. Once we're done with Atlas A, guys, you know, you take your first exam. Have you guys started looking at your study hints? There are 45 questions on the first exam in here. Normally, you have between 40 and 50 questions on your exams. They're multiple choice, so make sure you bring a pencil when you take it, and be on the lookout for the date. A student just called and she's having car trouble, and she says, we're supposed to have an exam today. I said, you're not supposed to have an exam today. I said, we're supposed to have an exam next week. I said, but remember I told you it could change. You probably won't have an exam next week. You'll probably have one on the following week. Okay, so I always put on Blackboard when you guys are going to have an exam. Okay, Atlas A, orientation to anatomy. I'm going to reference this, go back to this. Actually, this atlas, of course, is from I think the 5th edition, because this textbook did not come with PowerPoints for Atlas A. So the anatomical position, that young lady on page 29 of your textbook, and as Leslie stated, the body is straight, okay, the feet are flat on the floor, the legs are parallel, the face is facing forward, and the key word is the palms are facing what? Forward, okay, or supine, okay, which is another word, or supinated, okay. It's a stance in which a person stands erect with the feet flat on the floor, arms at the side, and the palms in the face directed what? Forward. The anatomical position, guys, is very important because it's used to locate accurate positions of body structures, regardless of what position you're in. So it's kind of like a frame of reference for human form. So that's the anatomical position. Like I said, I'm going to come back to this a little bit later. Yeah. Was this right here the anatomical position on your Learn Smart? Or what? Was it? Y'all do Learn Smart? Huh? Did y'all do your drill questions? Look, y'all gonna have to talk in here. Did y'all do your Learn Smart? That's a lot of y'all probably y'all have these kids. Okay. Here, forearm positions. So what's the anatomy term, the anatomical term for forearm that you may see on your test? You stop answering. Let somebody else. Anti-brachium, right? Okay, I'm going to go down the row and I'm going to ask you all words. Because some of them are on your test. All right? So, yeah, the forearm is called the what? Anti-what? Brachium. What's the anatomical term for your neck? Cervical. So where can I start? Do I start here or here? What's the, you start over here? Okay, I'll just flip flop. Okay, I'll go from here to here. Okay. What's the anatomical term for your hand? What's the anatomical term for your hand? Next person. What's the anatomical term for your hand? Can y'all just do a lab on this? This stuff is on those tests. We don't guess an anatomy now. What's the anatomical term for your hand? You want me to write it? Let's see. Here. All the way in the back in the red with her hand up. Only one person raised their hand. Thank you so much. You get extra points for raising your hand. Leslie? For your hand? It doesn't have manual in your list, in your book? Really? But you know where manual is. What page is that picture on? 32. Okay, 32. Okay. That's why y'all were putting dorsum, but see, for the foot, you should have put pedal. Some of y'all put dorsum and I marked it wrong, because dorsum is the top of the foot. Okay, the entire foot itself is called pedal. A few of you did put it, but with the hand, I can't believe, there must have been a typographical error. Because the back of the hand is called the dorsum. Page 34. See, if you, who's read Atlas A? If you look at the appendicular region, because that's where I took the question from, hand. It has in parentheses what? Manual. Okay? So the anatomical term for your hand, of course, that I'm looking for is manual. Some books will say manus, M-A-N-U-S. Okay? That's the anatomical word for the hand. Okay, when supinated, your palms face forward or upward, your radius and your ulna are parallel. Okay? So when you're in the anatomical position, like I say, your palms are either anterior, facing forward, they can be ventral, or they can actually be what? Supinated. Okay? I don't know if they mentioned supine in your textbook. We're going to talk about supine in another chapter. Supine, of course, is when you're lying in your bed on your back and you're facing the ceiling. You're in the supine what? Position. When you're in the prone position, that means you're lying on your what? Your belly region. Okay, or the abdominal region, you're in your what? Your prone position. Okay, this is supine. This is what? Pronated. Okay, so they're showing you, if you look, you guys are going to have to know the difference between the radius and the ulna. Okay, ulna, that's the radius. If you look at them when they're supinated, they're parallel to each other. But the moment you go into pronation, or the pronated, you have a cross like what? An X, exactly. The radius and the ulna are actually what? cross when you go into the pronated position. Actually, okay, the next thing, there are three anatomical planes. You have frontal, sagittal, and transverse. Frontal, another name for frontal is called coronal. Another name for sagittal is mid-sagittal. That's where you have equal divisions between the right and what? The left. You can have a parasagittal, but I don't think they have para, or I don't know if they have mid-sagittal in your book either. Transverse, of course, is when you're going to make a plane right across, separating the upper body from the lower body, superior and what? Inferior. Frontal plane is it's going to be a slice of the body that's going to separate what you're going to have the anterior and what posterior portions. Okay. Frontal plane implies an imaginary flat surface passing through the body. So what other word would you put in that blank for frontal? Coronal, right? Is that in your book? C-O-R-O-N-A-L. So what's another term for transverse? So just in case you see either or, horizontal, right? Either or on your test, they mean the same thing, okay? They're synonyms. Transverse plane divides the body into what? Superior and inferior what portion? Directional terms we're about to go to: anterior, posterior, superior, and inferior. So you guys really need to be familiar with those directional terms. I think I put quite a few on your exam. I'll probably give you guys a written quiz on those directional terms. I think I put like a YouTube video out there. Have you guys seen the YouTube video of this guy, someone explaining the directional terms? Because those directional terms, once we get past this chapter, that's all you're going to see. You're going to see anterior, posterior, ventral, dorsal, superior, inferior. Those are the terms that you're contralateral, ipsilateral, okay? And you need to know what they mean, all right? Does that make sense? Okay, anatomical planes. Now, they do have sections here. If you look on page 30, I don't have them up here in my PowerPoint slides. You can have sectional views of these different planes. Of course, it's going to, when you cut through a section, all it's going to do is just reveal those organs to you, the different sections, okay? Structures or internal anatomy. All right, so here we go. What time is it? Got 15 minutes to go through some of these. If you look in your textbook, page 31, this is my example I use in 201. Those are my examples I use in 201 when it comes to directional terms, okay? So that's why I pulled everything to the front today. Ventral means what? On page 31, towards the front or what? The belly. Where's your belly? Right here. Everything on the front of your body, guys, is considered ventral, okay? Now, look at dorsal. Dorsal means what? That, okay? Everything back here, and this is your spine right here. A little plane, that's your spine. Dorsal, it's also called posterior, okay? Ventral, also called what? Anterior. They're typically opposites, guys, which is going to help you to understand them. Okay. Anterior. What does it say? Towards the ventral side. Same thing as what? Ventral, right? Posterior, what does it say? Towards what? The dorsal side, right? Same thing as what? Dorsal. Okay? So the aorta is what? Ventral to the vertebral column. This red part of the heart right here is for the aorta. So on my side of the body, so the thoracic blood. This is ventral or anterior. The word is fine. I want to out for it. This is ventral or anterior. And what would this be? Posterior. It's going to be posterior, right? Why? What's the back? Why is the aorta ventral or anterior? Absolutely. Okay. Directional terms. Words that describe the location of one structure relative to another are generally called the directional terms of anatomy. Table A1 summarizes those most frequently used. Most of these terms exist in pairs with opposite meanings. So that's why I just asked you, why is the vertebral column or the spinal cord dorsal? I mean, because they're going to be what? Opposite, right? You got anterior, you got posterior, or anterior or ventral or posterior or what? Dorsal. So they have them, they're showing you the opposites, anterior versus what? Posterior, rostral versus caudal, rostral, caudal up here, okay? Medial versus what? Lateral. That's why I put it up there like that. Because they're going to be what? Opposites what? Of each other. Does that make sense? Okay. Now, please pay special attention to proximal and distal. I think there was a question on your lab this week about proximal or something pertaining to what? Shoulder. Okay. The terms proximal and distal are used especially in the anatomy of the limbs. Okay. Proximal and distal, I stress this to students all the time. When you use those terms when you're talking about your appendages, your arms, and your legs, you know. So students may say, well, why can't the elbow be inferior to the shoulder? Because that's not how they describe it in anatomy. Technically, it makes sense. I understand. I see where you're coming from. But in anatomy, you got to use proximal and distal for what? The arms and the legs. So if I put on your exam the wrist or the carpus is what? Blank to the elbow. One of your choices may be inferior. The other one is going to be distal. So you got to choose between the two. So which one would you pick? It's going to be distal, right? Why? Because it's referring, these are what these are part structures on what? Your arms, right? So you can't put superior. Okay. With proximal used to denote what? Something relatively close to the limb's point of attachment, which is your shoulder or your hip. You know, I like to draw this is my little figure up here that I like to draw in anatomy. I'm not an artist, that's why I majored in biology. But I'm put his hands on his hips. Look, her hands on her hip. What did I say? His hands on Okay. These are shoulders right here, right? Or the pectoral girdle. So you got the hips right here. Look at the little hips. Our hips. Okay. Hips or the pelvic region. You make a box or a square here. This is called your trunk. Trunk, guys, I want to correct you. That's your point of attachment. Point attachment for limbs or appendages. The appendages are a part of what region? There are two regions. start talking in here, start bringing quizzes in here, because I'm notorious for that. To make sure you guys, I like the students to know, okay? You can't get out of here not knowing. You cannot get out of my class not knowing. I wouldn't be able to rest at night if I let a student out of my class and they didn't know what region their appendages belong to. Speak up a little bit. My bum is back. Thank you. Remind me to give you extra points on your test. Appendicular. And then sometimes you get rewarded for saying the correct word. You know, for answering in class when I ask you, appendages, appendicular. Makes sense, doesn't it? Appendages, appendicular region, appendicular skeleton, which we're going to talk about. Axials, who said axial? That's like axis. That's the center of your body. Your head, your neck, and your trunk. This part right here. Axial, which is your head, the neck, and the trunk. Okay. The appendages, feet, the arms, and your legs. Okay, that's part of the appendicular what region. But anyway, moving on. So relatively close to the limb's point of attachment, the shoulder or the hip, and distal denotes something farther what? Away. Okay? These terms do have some applications to anatomy of the trunk. However, for example, in referring to certain aspects of the intestines, the microscopic anatomy of the kidneys, but when describing the trunk and referring to a structure that lies above or below another, superior and inferior are the preferred terms. These terms are not usually for what? The limbs. These terms are not usually for the limbs. Superior and inferior are not usually for the limbs, the arms and the legs. Okay? These terms, although it may be technically correct, one would not generally say that the elbow is superior to what? The wrist. Rather, one would describe the elbow as proximal to what? The wrist. Okay? I'll be using superior and inferior when I ask you the shoulder is what to your elbow, or your elbow is what to your wrist, or your fingers is what to your wrist. You know what I mean? So what would you say? Proximal and what? Distal. So like I said, it is. And in the past, they just added this information to this textbook. In the past, I have given students credit. I'm like, well, I understand what you're saying. I said, but you can't use, because it was not spelled out in the textbook, they could not understand why you couldn't use superior or inferior in regards to the limbs. I'm like, well, I'm just telling you how I was taught anatomy. I'm just describing to you how it was taught to me, so I'm going to teach it to you how it was taught to me. I said, but because it's not spelled out in your book, I would give them credit for it. So, proximal, distal, I think that's pretty simple. Let me just, where's my roll so I can call on someone. Let's find proximal and distal, okay? Because we're going to follow the way it is in the book. Proximal, closer to the point of attachment or origin, which is your shoulders or your hips, right? I like to say the trunk. Distal is farther from what? The point of attachment. So Tremaine came to my office yesterday, and he wanted to argue with the teacher. No, I'm just kidding. He was the one that came about that lab, about the shoulder. What was that question, y'all? If you have a fracture, was it a hairline fracture? That was on the, and the answer was in the question. There was a proximal end of the humerus. Where would it be located? I think it was something like that. This is your humerus right here. A little hairline fracture was up here, which is proximal, okay, which is the shoulder, right? Okay. So would the fracture be, I think the question was, right, would the fracture be closer to the shoulder or the elbow? And it was proximal, right? Because really the answer, like I said, it said you have a hairline fracture that's on the proximal end of the humerus. It was up here somewhere. It wasn't down here. But Tremaine wanted to say it would be down here. And you know what I told him? You can put that if you want to, distal, and I will mark it wrong. Look, do what you feel now. Do what you feel. So, you understand that, Tremaine? Tremaine understands me. He had me for 103. So yeah, it's proximal. So the elbow is what? Proximal to the shoulder is proximal to the elbow. So that means the elbow will be what to your shoulder? Shoulder supporter. Remember they're opposites. I just told you this. Yeah, be distal. Why is it distal? I mean, just, you know, when you stick your arm out if you want to. And say, okay, here's my elbow right here. Here's my shoulder right here. Think about distal as being at a distance, away, farthest away, right? Proximal, close, closest to you. All right. So, Jahan Edwards. Jahan, if I put on your exam, the fingers are what to the elbow, what will you put? Jahan, let's see. Scott. This one, why? Get your fingers right here. Put your elbow right here. See, behind your elbow would be what? Fingers are distal. What's the opposite of distal? Huh? Oh, guys, you got a lot of these on your test now. It's going to be what? Exactly. Jahan. I'm going to come back to you now because I want to make sure you understand this stuff. What's the example do they give you in your textbook? Proximal what? The elbow is proximal to what? The wrist. Distal fingernails are at distal ends of what? The fingers. Some students want to put on my test superficial. It makes sense. You know, they're like, but the fingernails are sitting on top. I said, well, if you have those long, wee press-on nails, my nails are just short. You know, I said, we're talking about your fingers here, and look at your fingernail. It is what? Distal, and the fingers are what? Proximal. The fingernails are distal, are at the distal ends of the fingers. Here, your fingers right here, right? What's your name? Jamie. Jamie, the knee would be what to your ankle? Good. And the ankle would be distal. Your foot would be what to your hips? Distal, right? And the hips would be what? That's easy, isn't it? Isn't it? What time did I get out of here? Got it. Let me say something about rostral and caudal, guys. You guys are going to see those two. You're not going to see them in 201, but you will see them in 202. Rostral, caudal. Those are really some terms that they just added to the directional terms list here. Rostral means what? Towards the forehead or the nose. Okay, this is rostral right here. Okay, now like it means beak, like a fish. The rostral part would be this part right here of a fish, the mouth portion and or the nose portion. Towards the tail in animals, and us guys, caudal is what? The tailbone or the spinal cord. So caudal in us, to me, caudal means the same thing as kind of inferior, right? this is your tailbone right here, caudal. It's like farthest away from the head. It's about when you towards the head region. All right. So rostrocaudal, you'll see in 202. I think when you talk about the brain, what's the example? Yeah. The forebrain is rostral to what? The brain, so that's like rocking. Because when you guys take 202, you're going to talk about the forebrain, the midbrain, and the hindbrain. Okay? This is your forebrain right here. This is the front. Forebrain is like right here. Okay? And forebrain is part right here. Okay? This rostral. So I kind of brought this in here to show you. So hopefully you guys will take Dr. Wilson. She would go into a little bit, well, it's not going to be more detailed, but I don't know. The spinal cord is caudal to the brain, and then we're going to stop. Caudal means what? What's the tailbone? Spinal cord is caudal. This is spinal cord right here. This yellow structure. Caudal to what is say the brain, or the brain stem. There's the brain right here, right? It's kind of like this is inferior, this is kind of like this is superior. So, I don't know if your book says you can use them interchangeably, but sometimes I don't tell students. Rostral, well, caudal means inferior, and one of them means superior. Okay? So we're going to finish up this chapter when you guys come back on Tuesday. So over the Labor Day weekend, you guys have a long weekend, make sure you read those cavities, because I'm going to come in here and I'm going to ask you, there are several questions on your exam on those cavities, which are on pages 34, starts on page 34, 35, and 36. So be familiar with the thoracic cavity, the organs that are in those cavities, the abdominal pelvic cavity, and of course you have your dorsal body cavity, which is the brain and the spinal cord. All right? Okay. If you came in late and you did not sign the roll, party by your name as you exit. If you have any questions, well, Dr. Wilson, 202 comes in here at, I think, 9:30, but